Good afternoon, everyone, and welcome. I'm Gail Cardew. I'm Senior Advisor at Science Business and Chair of the Science Business Technology Strategy Board. Now, the Technology Strategy Board was initiated last year to help shape our direction in the technology sovereignty discussion, and you can see much more about that on our website in the focus area section. Now, the board has taken an insightful approach to this topic, which is to focus on what Europe needs to have in place to ensure that technology in Europe thrives, and how Europe should best cooperate internationally to address issues of global concern. And we have two wonderful members of the board here today who can tell you much more about their thoughts. This event on GAIA-X is a perfect case study to examine these issues more closely, and I'm now delighted to hand over to my science business colleague, David Pringle, to chair this event today. Over to you, David.
Great, thanks, Gail. And welcome all to this webinar on Can GAIA-X Transform Europe's Technology? This, as you know, is a science business webinar, and it's going to look at both the scientific, business, and policy dimensions of this topic. GAIA-X is a flagship European initiative, and it's designed to ensure data security, build tech sovereignty, and address some of the concerns as well about the dominance of the global tech giants. But I'm going to let Hubert Tardio from GAIA-X talk a little bit more about that in a moment. But some of the questions for the webinar are how much impact will GAIA-X have? What are the challenges it faces, and how can it overcome them? We are going to look at this from various different angles. So I'm delighted to say we've got speakers representing different sets of stakeholders, users, policymakers, and citizens as well, actually. So our speakers today are Hubert from GAIA-X. He's the chairman of the GAIA-X Association. We've got Jeroen Tas. He's the Chief Innovation and Strategy Officer and a member of the Executive Committee at Philips from the Netherlands. We've got Maria de Gracia Cavallo. She's a member of the European Parliament. And we've got Antoine Petit. He's the chairman and CEO of CNRS, so a research perspective there. And Jana Sinapuro, who's project director of Fair Data Economy at the Finnish Innovation Fund, Sitra. So thank you to all the speakers for joining us. The way we're going to run this is we're going to make the webinar as interactive and conversational as possible. So I've asked each of the speakers to be concise, and that's partly to leave some time at the end for audience Q&A. Now you can put those questions in using I think it's the live Q&A function on the Events platform. So you can put them in at any time. We'll pick them up, and hopefully we'll get to them towards the end of the webinar. I'm going to ask the speakers to stay on mute unless they're actually speaking. We're going to have a discussion between us initially after first hearing from Hubert, who's going to introduce GAIA-X, short overview of what it's about and what it aims to do. And then we'll hear from each of the other speakers before getting into a discussion. So I think with that, I will hand the floor to Hubert.
Okay, thank you and good afternoon. Thank you, David. Thank you, Gail, for your nice introduction. Yes, I am the chairman of the board of GAIA-X after having taken the responsibility of being the interim CEO. We have now recruited our team, and I am happy to tell you that now the full team will be in operation at the end of this month. So GAIA-X can be looked upon on two different aspects. What is it in terms of objective? What is it in terms of association? What is it in terms of objective is really the combination, probably for the first time in this way of approaching, of addressing the cloud opportunity in Europe at a time when the Eurostat statistics are showing that only 26% of processing in Europe is done through cloud, while in the meantime, in the US, we are probably at a double of that figure. But this 26% is very contrasted between the northern part of Europe, especially Finland, Sweden, and Denmark, which are above 60%. And in the meantime, the rest of Europe, much lower, within the middle, France at 21% and Germany at 20%. So the first reason of GAIA-X is to say there is an issue, and that issue is clearly understood because companies do not want to move to cloud. They do not want to be prisoner of an absence of portability, so they want to have no lock-in. They do want to have interoperability, so it means that if they want to have a sharing of data with other companies which are not using the same cloud service provider, that should not be an obstacle. And they want as well to be having their sovereignty on the use of their data. I would like to say this is what I would call the lower part of the X of GAIA-X, which is about infrastructure and IT, but by no means this is the only objective of GAIA-X, which is also targeting to organize what we call data spaces. And data spaces are ecosystem of partners having decided to share their data in such a way that they can improve their performance and they can facilitate market penetration. It is interesting to say that data sharing in the business world is now becoming a very important topic, and I'm sure Jeroen will mention that. It is now becoming a board topic. We see that in the various data spaces on which we are working, typically on aeronautics. This is the CEO of Airbus who is taking care of that. In the case of health, Jeroen, as a board member of Philips. In the case of finance, this is the number 2 of Caisse des Dépôts et Consignations. So all that is showing that data sharing is becoming very important. And the decision of GAIA-X has been to combine those two approaches. I would say the infrastructure and application one and the data sharing one in the same project, on the basis that if you have the right plumbery without the usage of it, there is no need. But if you have only the capability to share without the infrastructure, you cannot do anything. That is for the objective. The way we have decided to address that is by putting together users, European service provider, but also international service provider, and have with them in-depth discussion about what are the best practices we need to push, and therefore put together policy rules which have been already published, but will be further published in the near future. All that is to use those policy rules as part of architecture of standards and to create reference architecture implementing this capability through the various domains we have chosen. Now, if I look at GAIA-X from the association point of view, this is an association which is a AISBL from Belgium law, which is today regrouping 230 members distributed between users, international service provider and European service provider, with the objective that to make all these ecosystem of people working together in such a way we can accelerate the data sharing, and in such a way we can accelerate cloud penetration in Europe, which is one of the handicaps we are facing today. With that, I have finished, David, within the 5 minutes.
Great, thanks, Hugo. We'll come back to obviously some of those points during this discussion. Thank you for that great overview. Now I'm going to ask each of the remaining speakers to talk briefly about what changes with GAIA-X, how their world will change, what impact they see it having on the way Europe exploits data and technology in general. So I'm going to start with Jeroen. Jeroen, let me hand the floor to you.
Thanks, David, and thanks, Hubert, for the intro. We're still in the middle of a pandemic. Vaccination has, AstraZeneca vaccination has largely stopped in Europe. And I've been looking at Israel, So why is it that such a large part of the population in Israel has been vaccinated? It's entirely a data-driven approach. They have made deals with all the pharma companies that they will give anonymized patient data that will help with the right protocols, the side effects, the issues that may occur from vaccination, and use that to shape their program. With other words, it's an entirely data-driven approach to an emerging problem that we still don't have under control. And so I'm not even talking about all the other issues that we have when we look at healthcare and the cost of healthcare and the big innovation we need in a model that basically hasn't changed in the last 70 years in Europe. Healthcare spend is going to continue to exceed our GDP growth. We have aging populations with a rise of chronic disease, which compounds the effects of a pandemic. Every European healthcare system is highly fragmented. There's a very slow transition to an outcome-based approach because we don't have the data on outcomes. And basically every hospital, every clinic, every GP practice is a little data island that doesn't connect to the bigger world. So that's in short, the obstacle we face. On the other hand, there's a lot of opportunity. We've seen virtual care explode. So people are used to dealing with their doctors in digital channels. Hospitals start helping each other on protocols, for instance, on COVID-related issues. We see a drive to really start pushing for interoperability and release the data from their core systems. And we see a whole new world of innovation emerging around that. And so I think we're on the verge of something big that needs the right conditions to be big. And I can give you hundreds of examples how data and AI can dramatically improve the diagnosis of disease because we can quantify what we see on images, what we can see in blood, what we can see in the pathology, how we can link genomics to disease, how we can start linking behavior, how we even can use tiny little wearables that we stick on a person to detect infectious disease. And to be honest, I've been wearing one for 2 months, and it is a real-time indication of whether I contracted the disease or not. While to travel, I still have to do a €120 PCR test and a quick test in addition to that, which is only a snapshot. While today we could do a €50 patch that continuously streams my data and can tell me whether I have the disease before the symptoms. But we can only do that if we have the infrastructure to do it. Now, nobody on this call will be surprised that building a new hospital is around $1 billion and takes 7 to 9 years. If we would spend $1 billion on a hospital, why is it so hard to spend money on core infrastructure that's essentially going to drive a complete new world of healthcare that will allow us to have real-time insight in a pandemic, to look at the way a vaccine is being delivered, protocols that can help treat it, pathways that can guide patients at risk because they have a pulmonary disease or they have a cardiac disease. All of this is possible if we take a data approach to it and if we embrace cloud as the way to do it. But then we're into some of the issues that Hubert said. People are afraid because they don't want to put the data with the large players for all kinds of reasons, many of them emotional, but we still don't have these spaces. We don't have the federation of data. We don't have the digital identities that underpin us. We don't have the end-to-end security that we can guarantee and the anonymization of data to deal, to strip out the personal aspects of that data. And I think we need a common approach to this. We need the investment to get us there. We need the portability of data, the interoperability standards, the identity management. And if we do that, I'm certain that there will be a whole new world of innovation emerging around it. I'm personally involved in 3 large scale-ups, both in the US and in the Netherlands, that would accelerate dramatically if we had such a data space available. And like the road system, you know, every country is sovereign in the way they develop their own road system, but we're connected. We allow traffic to flow freely, and we should do the same. We should allow data to flow freely and guarantee the security, the portability, and the end-to-end security and privacy. And it's possible, the technology is there. I think the standards are there. It's just the will to do it and transcend our tiny little islands of data. And I'm a big supporter personally of what's happening with GAIA-X, and our company is fully behind making this a reality. Thank you.
Okay, thank you, Jeroen. I mean, as you say, healthcare is a great case study, I think, for what GAIA-X could potentially achieve and some of the opportunities and challenges around it. So we will definitely come back to that theme. But now let's turn to Maria to hear from the policy angle and take a pan-European perspective on this. Maria, how will GAIA-X change your world?
Thank you very much for the invitation to be part of this panel, and congratulations, because really we are talking here today about the extremely important subject, the digital transition, and inside the digital transition, the question of data. And the previous talk really showed the example of health, where data is crucial for the advancement in health. We could see that also, for example, the development of the COVID vaccines, but not only there, in any field of health, we really need to have data and data space, and we in Europe are behind on that. We are now, and you know, from the Commission, European Commission point of view, the Council and the Parliament involved in several initiatives on the digital transition. Digital transition is one of the priorities, together with the green transitions of this mandate of this college. We have several initiatives from the Commission that the Parliament is working on data governance, and also on technological partnerships involving the digital transition. All these initiatives are community initiatives, so in certain way they use the community method, and this is a bit different on the structure that GAIA-X has chosen. GAIA-X, as I understand, is an initiative by the member states, that with some of the member states, starting with mainly 2 and after extend to other member states, and very supported now with a lot of involvement of the private sector. What I want to stress in my talk is the need also to link with the community method initiatives, because there will be an advantage that you are connected with the initiatives that are led by Europe itself, by the European institutions, linked with the initiatives of Horizon Europe, and to take advantage both the initiatives of Horizon Europe and the GAIA-X can benefit from this link. I have the privilege of being a rapporteur of the partnerships, the technological partnerships, what we call the private-public partnerships. There are mainly 3 that can be of interest. There are all total 11, but there are mainly 3 that are very much on the digital field. One that is the high performance computing, that is involving the objective is to place Europe at the forefront of the high performance computing, and including quantum computing. The second one is the key digital technologies, that is more devoted to electronic components, the design, the manufacturing, the integration systems, as well as software. and is very much target at the delay or the gap that exists in Europe on microprocessors. And the third one that is quite new, because these two already exist and there is a second version of the existing partnerships. The third partnerships is the smart networks and services that is going to support the development of the 5G infrastructures and applications, as well as the innovation capacities for the 6G systems as a basis for future digital services towards 2030. So these are examples of three partnerships that are in the digital world. On the application sides, we also have the partnerships, for example, on health, a partnership on global health that looks at the pandemics, but also is a follow-up of the partnerships on AIDS, malaria, and tuberculosis, but now is broader in scope, and the successor of the IMI, the Innovative Medicines Initiative, that is a partnership to develop new therapies, new medicines that will be fed in by data. So my main message that I want in these few minutes initial conversation is that we really need to work together between the GAIA-X and these initiatives that are mainly funded by the European budget, also co-funded by member states and private, but has a source from the European budget that will have also several advantages for GAIA-X to be closely connected with these initiatives. And thank you very much for your invitation.
Great, thanks, Maria. We will come back to many of those themes that you've raised. I think we'll talk about how GAIA-X relates to the EU common data spaces, and also whether Europe needs its own expertise in fundamental technology such as semiconductors and quantum computing. But thank you for that, Maria. So we're now going to move to Antoine, and he's going to give us a perspective on how GAIA-X may impact research in Europe. So Antoine, the floor is yours.
Thank you, David. So first of all, I think it's important to congratulate ourselves on the GAIA initiative, which is indeed a credit to Europe. As it has been said already, the health crisis we are going through has highlighted or re-emphasized the key issues of sovereignty with regard to vaccines and health, of course, but this issue of sovereignty is it's also important in many sectors, including digital. And I don't want to recall that we do this very nice web seminar through the Zoom tool, which is not really an European one. It's clearly a challenge for Europe to decide at which level the sovereignty should be dealt with, either at the member states or at a more global level. And obviously the answer is partly political, but it's also, from my point of view, technological. And in the field of digital technologies and data, critical masses are needed, and it's clearly necessary to share on a large scale. And it's why sovereignty must be understood essentially at the global level. And for all these reasons, GAIA-X is an essential project, and we must, it's my conviction, we must all act to ensure its success. And so the 4 points that I would like to make should be understood within this global, very positive framework. So first point is, how do we ensure continuity between research and production? The academic presence in GAIA-X seems minor today. And of course, the objective is to have a production platform. Nevertheless, I believe that it should be in our interest to build a continuum that will allow GAIA-X to draw on innovations from European research teams, which are successful at the very international level. The second point I would like to make is how can GAIA-X be positioned on the international scene? What will be the relations between GAIA-X and the non-European actors? As mentioned in the introduction by Gail, the Business Technological Strategy Board recently issued a statement entitled Open and Closed, a call to rethink the way we handle global research and innovation. And this statement points out, and I quote, our progress is hampered by the need to find a balance between two conflicting priorities, open science and open innovation on the one hand, security on the other hand. And this need must be addressed urgently at the international level. And from my point of view, GAIA-X is a perfect example of the need to answer to this question. Third question is concerning relationships between citizens and their personal data. And the health crisis has shown, at least in France, that this relation is complex. You can have the same person will agree to use GAFA platforms on a daily basis and let them exploit a lot of personal data, but the same person will refuse to provide a very small amount of this same data to a governmental platform with the aim to curb the spread of the virus. And from my point of view, this example illustrates the need, at least when we speak of personal data, to take into account from the very beginning the issues of trust and acceptability by citizens. And from a scientific point of view, let's not forget to call upon the humanities and social sciences. And my last and fourth point will be the constat that GAIA-X project is particularly ambitious. It has been presented dealing with personal data, industrial data, but also data from public, not industrial data. So sorry there. Your micro is off. So
no, Antoine, no personal data at all.
No personal data at all. Okay. Okay, but okay, sorry, but public data from public organization, which we was not far necessarily from personal data, but sorry for the error. But it also aims to stimulate the use of the cloud, encouraging data sharing, defining rules and standards. I think it's a lot. And there is a French proverb that says, Hubert knows it, qui trop embrasse mal étreint. And it seems that it has to be translated in English as who grabs all loses. And without questioning the ambition of the project, which is its charm and appeal, it will probably be essential to phase it well and to plan a few quick wins that will, from my point of view, reassure and encourage. Thank you.
Great, thanks, Antoine. I'll give Hubert a chance to talk about that, actually, come back on that point a little bit later. But finally, we're going to hear from Jana, I think looking in particular again at how GAIA-X may influence or help shape healthcare, which is very topical right now. So Jana, the floor is yours.
Okay, thank you. Yeah, I go back in time like 3 years when I was working as project director for building the digital health hub in Finland. And Finland was the first country to implement this GDPR compliant local legislation for secondary use of healthcare data. And from there, last year, we got this position to be a coordinator for towards European health data spaces joint action, where basically ministries and agencies, regulators and commission from 26 member states are working for the guidelines for the secondary use of healthcare data. And then being very long time within data and analytics business, I really appreciate this initiative at GAIA-X when I'm thinking that if we can at parallel levels work on the guidelines and policymaker level and create a little bit more agility in the use of these frameworks and putting those frameworks into practice and demonstrate, showcase how we can enable data sharing also for unregulated data, we hopefully can create something very good out of this situation. So basically, I think that this industry-led initiative allows us to build those broader data spaces, but we also might need this soft infrastructure like common rule books, templates, frameworks to enable trust between those different ecosystems. So that's why I think that it's crucial now to work at multiple levels, and also different industry leaders work for those principles for data sharing, so that we can maintain trust regardless of the system in place or local legislation in place. But hopefully in 2 or 3 years' time, we will see both policy recommendations and good suggestions and prioritizations from the TEHDAS joint action for secondary use of healthcare data, and have those technical enablers, common enablers needed both for primary use of data and secondary use of data, like identity management or consent management, federated systems there in place. So I'm excited for this opportunity, and I hope that everyone sees it in similar way.
Great, thank you, Jana. So let's get into some of these topics in slightly greater detail. Hubert, I'm going to start with you, because this, I think, is a question many people have around GAIA-X. Is you raised this challenge that we want more European companies, businesses using the cloud, and yet so essentially creating a safe, protected environment for them. Yet at the same time, GAIA-X has to fit into this global environment. Research is global, business is global, etc. So how do you get the balance right between integrating with what exists today, the public clouds and all that infrastructure that we all use, but also providing the safeguards that Europeans appear to want?
Okay, it is obviously a very difficult challenge. I would like maybe to borrow from Jeroen a very simple fact. If hospitals continue to have their data buried in a local data center, the chances that data can be shared between hospital, pharmaceutical laboratory, and medical company are very limited. That is one first element which says to us cloud is a necessary element of what will be the data sharing. Obviously, the other one, the reason why we do not have enough cloud in Europe, I have explained them. The consequences of that is that we are paying, because we do not use cloud, our IT more expensive than the one which are using cloud. Now, your question about how to deal between a global picture and a European picture is exactly at the core of the problem we as GAIA-X have sorted out our way. So let me tell you what is the way we have chosen. We have decided upfront that the board of GAIA-X will be reserved to companies which have their headquarters, their main headquarters in the European soil, okay? Meaning that we are happy to welcome companies coming from all over the world, but when it comes to the time to make decisions, that will be restricted to European-only company. When we have said that, and that was about 14th of July last year, we have had, as you can guess, an enormous explosion of irritation from the hyperscaler, from the US, but also from China. But what is interesting to say is that we have been wrapping up to see who was applying on a formal basis. They were all there into the GAIA-X proposition, meaning that there have been a very good understanding by them that if they do not accept to endorse some European basic values, their chances to continue to be very active in the European Union are limited. That, I would say, is the first thing, how we balance. But I would like to go back to the other thing that Antoine was saying, which is for me a very, very important point when it turned to research and development. I guess, Antoine, if I understand your question, how can we be open in terms of research, while in the meantime, we are keeping for a restricted circle some of the research that you do not want to be stolen out by other researchers in whatever country in the East or in the West. What we can say here is that the objective of GAIA-X is to organize for ecosystem of players willing to share data, the capability to share these data by having the proper ways, technical ways to do that on contractual basis, not on something which will be invented by any administration in the world. So I would say a contract of sharing data among the principles which have been initially invented by research, because you mentioned not enough research is in GAIA-X, but we have inherited all the international data space efforts for 4 years, okay, which gradually we have put very visibly, and I am very proud of that, to make data sharing from now on a board challenge, which is understood by many of our participants. So it is always in GAIA-X the balance between trying to promote the best usage of cloud in industry from the user point of view, with the fact that the users do not want to be prisoner of a European only kind of industrial strategy, which is keeping them at risk in the competition they are facing on a global basis. So that is always there. If I am to be very, very simple, we want to double the penetration of cloud in Europe in the next 4 to 5 years. Today, hyperscalers are representing 70+% of the offering in cloud. If we are doubling the size of the cloud market, the question is, which portion will it be in 4 years, 5 years from now for European cloud service provider? I hope it will be more than 30%. I am not sure, but I believe with the changes we have not yet addressed with the edge cloud, with artificial intelligence, many things will change, which are giving to Europe opportunities to gain bigger market share at a time when basically 80% of data are stored centrally and 20% are stored locally. And we know in 4 or 5 years from now, it will be exactly the opposite, 80% stored in the edge and 20% stored centrally. So there are plenty of new challenges, technical challenges, where we absolutely need R&D. And I can tell you, we are organizing now more and more contribution from R&D. But what we want is that a very large institution like CNRS recognize that the challenge we are facing are really important for the industry, and we are happy to share with them the question we have in mind.
Okay, thanks, Hubert. You covered a lot of ground there. Interesting stuff. But Antoine, I'll just give you a quick chance to respond to that. Are you reassured by what you've heard there?
No, I think we in fact agree. A success of the US and China is also based on the collaboration between industry and academy, industry and universities. And we made a lot of progress in Europe on this aspect. We still have progress to make. I am convinced that we have to develop on the inside or around GAIA-X more collaborations in order to help the best researchers and the best academic teams to collaborate with industry. I think that we have in front of us a series of deadlocks for which we can really benefit from a strong collaboration, and I think it's very good. And I am sure that, well, I know that CNRS is ready to participate, but I am sure that our colleagues in Germany from Max Planck or in Spain from CSIC and so on, and universities will be also very happy to collaborate for the success of Europe. which does not mean, of course, that we do not want to have international cooperations.
Great. No, thanks, Antoine. Right, I'm going to move to a different topic now. Well, it's actually related to this, but Maria, I was going to bring in, because you mentioned some of the work you're doing around these more fundamental technologies like quantum computing and semiconductors, etc. A question for you is, can Europe exercise enough control over its digital future or digital sovereignty if it doesn't create those fundamental technologies here in Europe and is actually doing that fundamental scientific research and technological development that underpins all of this stuff? So what are your thoughts on that, Maria?
Thank you very much. I have been defending since the beginning of this college, this mandate, that this notion of the strategic autonomy or resilience, these concepts appear. I have been defending that the best way to be resilient and to create strategic autonomy is to invest more in fundamental research on skills, on education, and to have also the necessary, the fundamental infrastructures. And this was, for example, the case on the development of the vaccines, the fact that we have developed the BioNTech as the first vaccine that came out and was approved all over the world with the very good results, is because we have been investing in fundamental research, and they have their company have been funded very highly by the European Commission and also the German government, apart from a private sector. But that fact that we are prepared with knowledge, with skills, with infrastructure is the best way to be resilient, more than to close ourselves. I know that we have to, in certain areas, we need to have a strategic approach and to probably not to be as open as we have been defending in the past, but I continue to defend that at least for fundamental research, we should have an open attitude, we should collaborate, and the fact that we are open and we collaborate will make the necessity that we are better than the others. And only being better with the others and only cooperate, we can have that measure that we are doing better. So being open, cooperating, and investing in fundamental research, investing in higher education, giving the conditions that we have the researchers in Europe is the best way that we developed ourselves. And we are, it's a fact that we are lagging behind in many areas. And in these areas, we really need to push in this way, not to close ourselves, but invest more in knowledge in these areas.
Okay, thanks, Maria. Let me get a quick comment from Jérôme on that. Does it matter that Europe isn't designing the world's best semiconductors or the world's best computing infrastructure, etc.? Is that important, do you think?
Well, let me first state that there's one provider of very critical technology for semiconductors, and it's a spin out of Philips called ASML. And these guys hold the key to production of the most advanced semiconductors. So we hold the key to something very precious. And another spin out of Philips called NXP is one of the leaders in semiconductors. So it's not that we're standing empty-handed. But I think, indeed, resilience in these spaces is absolutely a necessity. I think we need to continue to invest both in the science as well as the design of these technologies. And I think Maria pointed them out, semiconductors, absolute must. 5G, 6G, absolute must. Edge computing, I think Hubert said something interesting. We're very focused on the cloud, which is hugely important, but the intelligence is really moving to the edge, to the extent that we even consider MRI, €1.5 million MRI machines as edge devices. Ultrasounds, patient monitors all become edge devices. So I think there's a lot to be gained over there, and we need a very strong relationships between science, research, R&D, and indeed to continue with production, and especially in data that becomes hugely important, because in production you generate a whole lot of data, and that data becomes the source for deeper insights and algorithms and intelligence that basically then becomes the engine for the edge. So you need both. There is no edge without a cloud, and there will not be a cloud without an edge. But you have to understand the interworkings of the two, and much of that is data driven. And data needs scale to create insights. And again, going back to my earlier example, if every hospital is going to sit on their own data, or only very selectively shares data, we're never going to get the base to truly treat cancer, to stop a pandemic, to get to the next level of treatment in neurological disorders, which is still terra incognita. So there's plenty of opportunity to bring all these things together, you know, edge computing, cloud, basic research on the semiconductors that drive it, and most importantly, the data that fuels it all, because without that, we're not going to create self-driving cars or you know, autonomous ultrasound where you don't need a specialist. You can actually use ultrasound to do a selfie of the inner self instead of your face. So all of that is possible, but it requires investment in science, in these basic technologies, and in data.
Okay, got it. Thanks, Jeroen. Okay, I'm going to bring in Jana now, because Jeroen mentioned an important point about actually getting people to share data, and obviously that's critical in a healthcare context. And I think critical in the context of GAIA-X is the extent to which we can get the private sector to share data and get companies to actually participate in this, and not see their data as their crown jewels or something that's commercially sensitive and that they shouldn't share. So from your perspective, are there enough incentives for private companies to share their data?
That's a very good question, and I think if we think data as an infrastructure, there needs to be like strategic mindset also on data. So having data strategies in place and seeing data as an equity, as an asset of the company. But I think that there are still lots of concerns about sharing the data, and also maybe we need some skills building in making companies to see value of the shared data. So it's still very much the siloed approach, that not enriching data with various sources of other companies' data. So that's why I think we need to have this trust infrastructure in place as well, saying that these are the common, well, rules for sharing data, and we will use this data only for this kind of service building. And we use these pseudonymization or anonymization methods for data, for integrating it. So some parts of data can be shared, and some will be still very siloed and owned by the companies. But I think that we need to have those practical proofs also, easy starts showcasing that actually the shared data creates much more value than data stick to the silos.
Yeah, I think that's one of going to be the critical success factors for GAIA-X, is the building trust and confidence in those mechanisms and giving the private sector the incentive to actually participate in that way. But now I'd love to discuss this further, but we've got quite a lot of audience questions. So I'm going to turn to some of those, and we may be able to come back to some of these issues towards the end. So let me just give you a chance to answer some of these audience questions. The first one is actually for Joan. Are you sure that Europe has not actually lost the race versus our competitors in the US and Southeast Asia due to the complacency of European politicians relying completely on, and this is in quotation marks, I'm not sure why, free gifts from the billionaires in Silicon Valley? So I think the question is, are you being too optimistic about Europe's opportunity here?
Is this free for all, or can I?
That was a question for you, actually.
Oh, okay, good.
It was actually tagged with your name on it. So this is
great. No, I think it's an excellent question, and to be honest, I believe that you have to also leverage what comes out of the US. You know, I lived in the US for 25 years. I also lived in Asia for 5 years. But there's something about the scale at which things happen in the US. And there's a reason why the companies mentioned are so big and successful. And I think what hinders us is this scale thinking. You know, we tend to immediately start looking inward, and I think, you know, we need to have a little bit more bolder vision and basically transcend our relatively small worlds. And I think we have a lot going for us. There, you know, the science in Europe is at least as good as in the US. You know, the capabilities are there. What's not there is the scale. And I think that's where GAIA-X can help and say, hey, let's do this together. Let's do this, you know, at the start at scale, and not, you know, in my tiny little world, which might be important, but it's not going to move the needle. And I think that bolder thinking, that putting things at a larger scale, being willing to put your mind around that, and I think it's a necessity for us to be ultimately competing in a global world where, you know, in a way we will be competing with China, in a way we will be competing with the US. But there's also still a lot that we can leverage, but we definitely have to think bigger.
Okay, thanks, Jeroen. There's a related question, which I think I'll put to Hubert, actually, because this is along the same lines, but it sort of builds on it. So the question is, I really like the philosophical approach of GAIA-X, which goes together with EU values. The key question is, how will the industrial implementation match AWS, Azure, and Google Cloud? In mobile phones, we used to have Symbian driving Nokia phones, which had similar open value proposition, but Android and Apple executed so much better, so nobody cared about its openness. So in other words, I think the question is, could European values get swept away by commercial considerations?
Okay, so I guess it is an excellent question. There is no intention whatsoever in GAIA-X to pretend that we will put on the market commercial products, okay? What we want is to build and design policy rules. We want to design architecture of standard. We want to design federation of service. Up to the point we will deliver reference implementation, which could be adapted very clearly to specific market like health, like finance, like automotive more and more. And so the idea is at the end to show that data sharing can be really handled on industrial basis using the concept which will be created in GAIA-X. There is a second step where we have made that demonstration, and as we have discussed often with Jeroen, we believe the most successful implementation will be done in highly regulated markets, because these markets are surveyed very, very carefully by banking authority, health authority, and so on. And that is where we can help industry to get more relaxed attitude from the regulation authorities, and to say that digital can do much more than what it is doing today. Probably banking is the most interesting example. The money laundering regulation is forcing banks to do on behalf of the banking authority all kind of checking, which could be done by digital if we were trusting enough digital. So building reference implementation and showing it is possible is definitely an element that we want to push. Okay, that's really my answer. Antoine said we are embracing a little bit too much. I do not believe so. I believe if we limit ourselves to make the demonstration in given domain where we can have business value of what we are proposing, that will have an enormous attraction, and that will help other implementation, which will be done by the various companies which are forming GAIA-X.
Okay, thanks, Hubert. We've got quite a few questions actually, so I'm going to kind of rattle through a few more. But Antoine, I think I'll put this next one to you. So it's, do you think EU regulation will stimulate adoption of GAIA-X? In other words, GAIA-X will be GDPR native, and could this be its unique selling point? And I'm putting this to you because I know researchers, or some researchers, have struggled with being compliant with GDPR, or have struggled to interpret how it applies to their research. So if GAIA-X makes that easy, that could be helpful, couldn't it?
Yeah, I'm not sure to be the right person. You know that usually researchers do not like regulations, but now I think we have clearly understood that these regulations are absolutely necessary as far as we come through industrial products, and each now academic universities or research public research organization knows that we have to deal with regulation, with GDPR. I don't know whether GAIA-X could help in that spirit. I think it's clearly an issue, but it's I think come back to the question of also acceptability. We have to, and it's not my job, it's more Hubert and your own job, is to make things in such a way that regulations are not too complicated. I think that researchers agree for regulations, but it not to stop or to speed up their research, and that's clearly a key issue.
Okay, thanks, Antoine. I'm going to move to another question. I'll put this to you, Jana, actually. This is healthcare related. It's slightly long, so bear with me. Over the past 50 years, many attempts have been made to solve the health delivery issues using data, but most have failed. Some would argue that this is an organizational issue rather than a data issue. What is distinctive about GAIA-X that will enable this? And we can do specific issues such as pandemic control as a one-off, but can we actually scale that to overall health delivery? So I think the question is it really about the way healthcare is organized rather than data?
Yeah, and of course it's very hard domain, but as I was explaining this TEHRA's joint action, trying to streamline different practical interpretations of GDPR and make more coherence for the legal framework and landscape we need to operate on. That's one part. And then if we, with this community approach, different organizations trying to solve those practical topics together. And also I'm a strong believer in technological advancements. So very often we say that data quality is a topic, but we need to challenge our thinking there as well and use a broad set of skills. And I think that this kind of community approach, having a good experience from the companies, helping policymakers to solve the topics, will lead the way to the future. So I've heard the same discussions that it's impossible to create interoperability within healthcare or within healthcare domains or institutions, but maybe it's time to shift our mindset a little bit, at least.
Right. Okay. Got it. We're very, thanks, Jana. We're very close to the hour, but I think we've got time for one last question, which I'm going to put to Maria because it's quite a big question about Europe's positioning. It's a very long question, so I'm just going to cut to the end of it. But I think it boils down to a large part of the population is essentially digitally illiterate, and this is and doesn't really understand how to use data and collect it and deal with it responsibly. So I think the question is really around, does Europe have the human resources to actually, well, effectively harness data and probably artificial intelligence? So I'll let you comment on that, Maria.
Thank you very much. One of the barriers in Europe is actually the lack of skills and capacities in the digital. On specialists, we are lagging behind. We don't have enough researchers and informatic engineers compared with, for example, Southeast Asia or other parts of the world that we compete with. So we need more specialists in the areas. But there is another dimension that is also very important, that is the basic competences of the population, of the general population. And we really need to have basic skills that is given to the population in general, both in digital, data, and principles of AI. And it's so crucial that it's like reading and writing of the past. It's going to be the new reading and write to understand what is going on around you. And we know, and I think Joanna could probably tell us, but countries that Nordic countries and Finland have already programs to give basic skills to the population. In the European Parliament, we have asked the member states to use part of their recovery and resilience plans exactly for the training of the population. And we know that in many member states, like my own in Portugal, that we really need a program like that. The government has included the plans to give training to the population in general, and that is very, very important for the transition that we want to go through. So more specialists, but also the basics to the population is a very important task that we have in front of us in the next few years.
I'm just come off mute there. So thank you, Maria. That's very good broader point. We are now actually out of time, so and we haven't unfortunately addressed all the questions that have come in, but we may be able to address some of those around by email. Some of them are around things like patient consent and the extent to which GAIA-X will help with that. And there's also a couple of questions around people wanting a better understanding of GAIA-X's value proposition and how it takes things. We will look to address those in further discussions, or as I say, via email. So I'd like to thank you, the audience, for joining us today, and thank you to all the speakers as well for a very good conversation. I know we've only scratched the surface of many of these issues, but unfortunately that's the nature of the online world that we live in. Maybe we can do this face-to-face before too long. There will be a recording of this webinar available through Science Business, so you'll be able to watch a replay of that back and pick up on any of the points that you want to explore further. But thanks again all for your time and your insights and contributions. Thank you.